Good morning. We are working on Christian marriage, and this is the seventh class. Actually, that is the eighth class, but the seventh topic, that is obsessive compulsive disorder. Well, many mental disorders are getting popular. So, because modern people, I don't know. We are living in very advanced technology world, and there are so many things supporting people's life easier. But I don't know. Somehow, actually, there are many reasons for the mental disorders, but people's mental health is getting worse. It's kind of an irony, right? Our lives are getting easier, but we are getting more mental health problems. So the problem is that how we can manage those things. Okay, what are there? What kind of mental health problems are there? We want to understand what's going on, and we want to understand how to take care of it. And diagnosis is kind of complicated, but that is man-made categories, though. So when we have mental disorders like these, our life is not easy at all, because our bodies are okay. We have good enough resources for living. Actually, some people don't have those things, but we cannot manage our lives normally because we have a mental disorder. It's you cannot see what's going on in here or here. Okay, nowadays we are talking about this though. And how we can, know what's going on to us, and how to understand those things, and how to solve those problems. Okay, those things are very crucial for our healthy lives. Unless we have to live under big stresses because of the mental disorders. Obsessive compulsive disorder is one of them. Okay. Well, that is what's so-called OCD, and maybe that is kind of new for some people, but it doesn't mean that they don't have that. Okay. Majority of people don't understand what's going on in them. That's why. But they feel something wrong, but they don't know what's going on. So this is kind of helping people to understand what's going on in their mind and spirits, and we can just help them out how to solve those things. Obsessive compulsive disorder, OCD, is an anxiety disorder. That is anxiety disorder. So anxiety disorder is kind of a bigger category, and under that we have obsessive compulsive disorder. That affects 2 to 3% of the population. So 2 or 3 out of 100 people are getting anxiety disorders, especially OCD, and that is not small amount of. So quite a lot of people are getting these. It usually begins in late childhood or early adolescence. Okay. People with OCD experience recurrent and persistent thoughts. So one thought or particular thoughts are just staying there. It's not disappearing. Okay, it's hard to resolve it. So it's there. It's there. It usually begins. People with OCD experience recurrent and persistent thoughts, images, pictures. Okay, the situations which triggered that, and there are intrusive and unwanted. Okay, so obsessions. They don't. I think we can have a little bit similar, experiences like this. So, what if you have? What if you saw a car accident and you were very close? There was close call for you, and then, but when you, I think definitely because you watched this car accident, you're gonna just remember that scene for a while. But it disappears, as time passes. That's natural. But it stays in you for a while. Because it disappears, you still remember that, but the scene and the sound and shock is still there. But and then it doesn't want to leave you, so it stays there. It's kind of traumatic. But what if you just stole something in the past, and you are just thinking that you just stealing, kind of imaginings, something like that. They also perform repetitive and ritualistic actions that are excessive. Okay. Time-consuming and distressing. That's compulsions. Time-consuming and distressing. People with OCD are usually aware of irrational and excessive nature of the other obsessions and compulsions. However, they feel unable to control their obsessions or resist. Sorry, it got cut. Sorry about that. And compulsions. Resist their compulsions, I think. Yeah. So, obsessions is recurrent and persistent thoughts, images, or impulse that are intrusive and unwanted. That is obsessions. And compulsion is kind of repetitive and ritualistic actions that are excessive, time-consuming, and distressing. That is compulsions. Well, can you imagine, these kind of things are staying in your brain and mind for a long time, and whenever you just, walking on the street, just sitting on your desk, while you are working in your working places, in your home, and the church or wherever, you have that kind of things in your mind. That is kind of painful. Obsessions are usually exaggerated versions of concerns and worries that most people have at some time. Yeah, we have those, right? You concern, like, well, for example, I just drowned in the water when I was a little kid. So I had a phobia. And whenever I go, swimming pools or something, I just remind that incident, and I just imagine, what if I drowned at this time and die? Last time in the past, I got saved by a person, but I remember I was just, I still remember when I got drowned when I was a child, and I couldn't do anything, but I opened my eyes, and my body is just, kind of just wandering down there, and I saw and remembered that short scene. Okay. Then it took, I think, almost 20 years or more than that, until I could swim. I could challenge swimming when I was 27 or 6 or 7. Okay, I didn't take the swimming lessons, but I just soak in the swimming pool at the corner in a very low spot, and then I was thinking, can I make it? Until then, for like 20 years, whenever I go swimming pool, I remind that bad event, and I used to think that, what if I'm gonna drown and die? Right? That is kind of an exaggerated version of conscience and words. Well, I think I got that obsession for like 20 years. Well, later on, I just tried by myself, in the swimming pool, and kind of, copy what other people are doing, and I evaporate. And I just heard something what coaches are teaching in a class, so I just tried that thing, and I could master the swimming. Master means I could swim 1 kilometer without any rest. So it took some time, like 3 or 4 months. Can you imagine what I felt until then? Okay, so common obsession. There are common obsessions. So those are common obsessions. Fear of contamination from germs. We are living in coronavirus world, pandemic world. So that is kind of almost all people are having, right? What if I touch this, and then I can think, somebody touched this before? What if the person got coronavirus, right? Well, I like shopping at Costco. It doesn't have a variety of products, but they have good products, I think. So I like going Costco, and they are changing some items. So, and they used to clean with kind of a special sprays or something. Okay, because people worried the contamination, but they are not doing anymore. Okay, because people are thinking coronavirus is there, but majority of people got vaccinated, so they think it is safe right now. But is it really? We have Delta variant, and people still are dying because of it. Even they got vaccines, but they got coronavirus again. So we have a fear, we have obsessions. So germs, dirt, poisons, and other physical and environmental substances like sharp things, knives. Okay. And fear of harm from illness. What if I got it? What if I got sick? Especially people who are living alone, they have more fear than other people who are living with others. Accidents or death that may occur to oneself or to others. What if my son has car accidents? Actually, he was involved in car accidents a couple of times. I feel that. Oh, son, safe drive, relax. Okay. Pay attention to what's going on in your front. Watch, side, off, and rear. Something like that. Parents can say that kind of thing. That's a kind of common obsessions. This may include an excessive sense of responsibility for preventing this harm. I have to prevent, bad things, so I have to tell my kids and people, do this and don't do that, and they don't like it anymore because they are adults, but I can't stop saying those things. Actually, I'm trying not to say, but even I just think, I don't speak up, but I think, oh, be careful, guys, something like that. Okay, actually, last night I was on Freeway 5 at night, and there was really big car accidents, and so more than 5 or 6 police cars were there, and 2 or 3 tow cars. And I saw a truck got, I know that's a half broken, right inside of the front. Intrusive thoughts and images about sex, violence, accidents, and other issues. A friend of mine, his wife got raped after she just stopped by his working place. After that, both the couple got really mad, and my friend bought some guns. It was very hard for the couple to overcome that bad incident. And they couldn't stop worrying about each other. Whenever they talk about that, or whenever they avoid to talk about that, they got big stress, because what if bad things are happening again? What if the guys just followed her or tried to kill or harm the guy, my friend? We can think, we can imagine so many things. So that is intrusive thoughts and images. Excessive concern with symmetry, exactness, and order lines. Jack Nicholson performed really nice. I like Jack Nicholson, his type of acting, and he's the person who wears his black socks only once, no washing. Wear the socks once and threw it away. So he got lots of black socks. He used his soap only once. Open the new soap and use it and throw it away. That kind of person. And he just organized all clothes and things very tightly, But that's actually happening in this world. It's not just acting only. Some people have that kind of thing, okay? Excessive concerns about illness, religious issues, okay? What if I got sick or something like that? Obsession may be constantly on a person's mind. Yes. They may also be triggered by physical objects like knives, guns, something sharp, needles, and situations, swimming pools, smells, burning, What if somebody's house burnt when when he was young? Or something heard on television, radio, or in a conversation. Obsessive fears usually move beyond the specific trigger. For example, a bottle of coolant. To include anything that might look like it or have been near it, such as cars, car keys, a puddle on the road, supermarket shelves, and petrol stations. Okay? So you can be, obsessive fears usually move beyond the specific trigger, right? So those are kind of normal, car keys. We use car keys every day, right? But it can trigger the obsession. It's the hard part, right? Obsessions can change in nature and severity and do not respond to logic. Yeah. Obsessional anxiety leads to vigilance for possible threats and compelling need for certainty and control. Obsessions can produce feelings ranging from annoyance and discomfort to acute distress, disgust, and pain. Okay? So obsession is not huge, enormous feelings, but it can be just a little, annoyance or discomfort. Okay? But it can be, huge panic for some people. So they can't move. When they see, they can move. Jack Nicholson, he never stepped on the lines. This floor is kind of what's so-called decorate tiles and a little square, 1 foot, I think that must be 1 foot, I think. One square foot ties, glued down here. But he never stepped, because he never stepped on the lines, he has to tiptoe, and walk on the floor for avoiding stepping on the lines. That is kind of traumatic, and that is kind of obsession. Obsessional anxiety leads to religions for possible threats and a compelling need for certainty and control. Obsessions can produce feelings ranging from annoyance and discomfort to acute distress, disgust, and pain. And those are things like that. Symptoms of OCD. Compulsions. Compulsions can be behavioral actions or mental thoughts. Compulsions are repetitive actions that are often carried out in a special pattern or according to special rules. Yeah. And compulsions are usually performed to try and prevent an obsessive fear from happening. Because stepping on the line is kind of it can be traumatic for the Jack Nicholson, so he has to tiptoe. That is an acting for avoiding obsessions, right? Because he got trauma, with stepping on the lines. Compulsions are usually performed to try and prevent an obsessive fear from happening, to produce the anxiety the obsessive thoughts creates, or to make things feel just right. So just wash his hands with a new soap and throw it away. Because he worries about the germs. He worries about kind of many things. He used to go a restaurant he likes, and he has to sit in a particular table. So he almost always booked for the table, and one day he found his table is occupied by other people, so he complained to the restaurant, and he couldn't eat over there because of it. Yeah. Common compulsions include excessive hand washing. Well, washing our hands is kind of habitual item nowadays because of the pandemic, and I wash my hands, often as much as I can, right? But whenever I'm home, I just wash my hands first. So when I open the back door and get in the through the patio, I just get in the home, and there's a kitchen sink. I just wash my hands first there. Because I just touch so many other dirty things in the outside. So I don't want to just invite all the germs inside the home. Well, but I don't have the faucet outside and soap. That is too much, I think. So as normally I as almost other people are doing, I just wash my hands inside the home first. But what if some people wash their hands like 100 times a day? Showering and toothbrushing. Some people I know actually are one of the excuse me. One of the celebrity, he's taking shower for 1.5 hours. I don't know, he's peeling his skin off. I don't know what he's doing in there, but it takes almost 1.5 hours for him to take a shower. Not bath. He's not taking bath. He's taking shower, but it takes 1.5 hours. And toothbrushing. Well, a couple of years I just saw my dentist, and he just recommended me not to brush my teeth with kind of hard toothbrush. So he just recommended me soft brush because he just saw kind of rough marks on my teeth. So, well, I didn't understand why, but I'm thinking I'm still brushing hard. So that's the problem. So whenever I brush my teeth, I feel, am I brushing too hard? But I just brush it that way. It's cool for me, if I brush, softly, I don't feel it, I just brush my teeth. So, anyway. Excessive cleaning and washing of house, household items, food, car, and other areas, that's compulsions. A person I know, and he's doing that, He doesn't do anything else but cleaning his house. Well, I think the cleanliness is good. We want to just keep our environment and rooms and house clean, but if that is too much, that is too much. What can I say? Excessive checking of locks, electrical and gas appliances, and other things associated with safety. So you just lock your door and you turn your car engine on. You think, did I lock the door? Did I turn the lights off? And you just get in the house again. You check it. You checked it. Literally, you checked it. That is the second, checking. When you are in the office, you just think, did I lock the door? Some people go back to home and check it. It's not about, memory problem. It's compulsion. They know that they remember that they locked the door, but they want to just make sure again and again and again. Repeating routine activity. What about the safety? Oh my goodness, recently I just watched a video clip, and a guy, he's gun guy. He has lots of guns in his home and in his car. I think he got more than 2 guns in his car. And he just put, lots of guns in his home, behind the doors, on the, beside the bed, in the kitchen. Oh my goodness. Safety is important, but I think that is too much, right? Compulsion. Repeating routine activities and actions such as reading, writing. Can you imagine that reading and writing can be a part of compulsion? Well, I just remember whenever my son got mad, he reads. He read books. It made him calm down, and he slept. Yeah. Reading, writing, walking, picking up something or opening a door. Those things can be common compulsions. And applying rigid rules and patterns to the placement of objects, furniture, books, clothes, and other items. The world famous tennis player Nadal, he has his routine. I think that he got, I don't know how many routines he needs for playing tennis, like 16 or 15, maybe more or less, I don't know. But it must be more than 10. That's what I remember. When he put his water bottles, 2 water bottles in front of his chair in a particular way. He has to show the logo toward, I don't remember, and he has to, bounce his ball before the service. He just bounced the ball for particular numbers of, and he just touched it with this. I don't know. He got so many routines. I think there can be a nice routine, but it is too much. I think that's what I think. Who cares the water bottle's logo? Right? I think. Well, I don't want to say he got compressions or whatever, but cause I haven't talked to him, so, but I'm pretty sure he got, some particular level of compression, right? It's not just routine. Touching, tapping, or moving in a particular way or a certain number of times. Needing to constantly ask questions or confess to seek reassurance. Oh my goodness, it reminds me of a person. I just took a class with a person in, that was kind of a small class, like 5 or 6 people, six students, and that was wasn't a real school class, but kind of intensive seminars for a week. Oh my goodness, right after the professor, mentioned something, he just asked the, kind of questions, but that is actually asking, repeating the same thing what professor just taught. Oh my goodness, that was painful when I was sitting in the class. So, oh my goodness, next time I just sit away from him as much as I could. So it was a very torturing experience. Professor taught 1 + 1 is 2, but he right after that he asked the professor, what is 1 + 1? Something like that. Oh my goodness, that was really bad. Manually repeating words or numbers a certain number of times, or concentrating on good or safe numbers. Yeah. I was told that Chinese likes number 8, so when they want to buy a house, if the house has the number 8, they love it, they like it. I don't know if that is true or not, but when I visited Vancouver, Canada, a long time ago, I was told that around, I think 5 or 6 years before I just visited Vancouver, the Hong Kong just returned to China from England because England occupied Hong Kong for 100 years. That was a sad story, right? One country just occupied the other country's territory, or even other countries. That is not acceptable. Why? So greedy, so violent. No one, those countries cannot say about the human rights or something. What is human rights? They tortured all other countries' people and occupied some places. And they are talking, do you think they have a right to talk about the human rights? No, no way. They have to shut up. It is okay because they are advanced countries. Shut up. They have a dirty history. Shut up. Replacing bad thoughts with the good thoughts. Good thoughts. That is kind of, whenever you have a bad experience and remember in memories, but you wanna just replace with good thoughts. That is kind of a self-protecting systems, kind of. But anyway, we have common comparisons like those. Usually comparisons become like rituals. They follow specific rules and patterns and involve constant repetitions. Well, rituals are great. We have certain, religious services, and we have kind of a routine. But ritual is a little bit higher level of routine. And ritual is more like a spiritual thing or something like that, but comparison is kind of a disorder, right? The comparisons give an illusory sense of short-term relief to anxiety because they don't want to just face they want to just release the anxiety, so they have to bounce or something. They have rituals or they got trauma on the lines, so they don't want to just step on the lines anymore, or they got kind of bad experience and memories about soap or socks or something. There's so many things, That's for releasing and calming down and avoiding and taking care of their anxiety, right? However, they actually reinforce anxiety and make the obsession seem more real. So the anxiety soon returns. So the more you want to avoid stepping on the lines, that means you have to pay attention to those lines. By doing so, you just recall the bad memories related with stepping on the lines. Because you want to wear your socks only once with particular reasons, typically bad memories, bad memories or something, and then you have to pay attention you have to buy new socks and stack on it in your closet. And then you have to open the new socks and wear the new socks on, and you have to throw it away. You want to just avoid your anxiety, wearing kind of used or or kind of old socks, but you have to pay more attention to your socks, which means you are recalling the bad memories back. So you cannot leave that trauma or anxiety at all. Okay? That is kind of circulating, repeating. OCD can have a profound effect on a person's life. Comparisons and obsessions may take up many hours of a person's day and can interfere with family and social relationships. They can also have a negative effect on education and employment. Okay? So OCD can, make our life harder. And it's going to be very hard. Sometimes it's going to be very hard for those people to build good relationship with others. Social lives, their social lives can be different. Different means other people can feel, feel not comfortable with those things. Right? So it can have a bad negative effect on education. and employment. Because people think they are weird, or because they don't understand what's going on others. As OCD becomes more severe, avoidance may become an increasing problem. Avoidance, okay? The person may avoid anything that might trigger their obsessive fears. Sure, it's the same to all of us. We don't want to just repeat the same problems or feelings and experiences, so we want to just run away from that, right? But as OCD becomes more severe, avoidance may become increasing problem. The person may avoid anything that might trigger their obsessive fears. OCD can make it difficult for people to perform everyday activities like eating, drinking, shopping, or reading. Well, eating is good, drinking is good, shopping is good. But what if you ask hundreds questions to the sellers? Because you concern the safety. So when you want to buy a car and you just ask hundreds of questions to the sellers, and you call, you ask to call engineers and ask hundreds of questions to the engineer. Do you think that is normal? It's not, right? So it's gonna be torturing those people, sellers, salesperson, and the mechanics too. Some people may become housebound. OCD is often compounded by depression and other anxiety disorders. You concern some particular thing, you don't feel very good because because you are paying attention to a particular thing, because you had bad memories regarding that or bad experiences and feelings on it. So you have to remind that, and you're gonna just feel what you felt in the past in the incident, and then you're gonna just feel that thing. When you just recall, kind of sick and nasty memories, you feel sick and nasty when you recall that memory, right? When you recall an accident, you can recall the smells and sound and the scenes. Same thing, right? Including social anxiety, panic disorder, and separation anxiety. Right? Well, we can see separation anxiety not from people but from our pets too. Right? A dog owner just passed away, and the dog just refused to eat and drink, and the dog stayed in the gravesite many days. People tried to feed the dog, but the dog just refused it because of the dog is too much, feeling so sad, and the dog just died. Well, it's kind of expressing more that even a dog, not all the dogs, but even a dog can feel that kind of a thing, feelings, bad feelings, and sorrows, and sadness, and anxiety. I mean, separation. I think we can call it. It's not. I don't know. hard to say it's separation anxiety, but it's kind of sadness and sorrow and that happened. It's kind of sad story, isn't it? Right? Because we are taking, we are just dealing with mental disorders like this, and we feel, a little bit depressed, sometimes because we have to talk about the disorders and examples and cases. So sometimes, and then we can have those kind of similar experiences or same disorders we had or we have right now, and then we can just feel a little bit uncomfortable with that sometimes. And people with OCD are often acutely embarrassed about their symptoms and will put great effort into hiding them. Yes, so we can just notice there are lots of lines on the floor, but we don't want to just pretend that we have that kind of problems or compulsions, so obsessions. So pretend not to see the floor, but actually you can see the floor and avoiding the lines. It's going to be very hard. Before the disorder is identified and treated, families may become deeply involved in the sufferer's rituals. Sufferer's rituals. Yeah. For example, you caught a cold, but you don't know you got cold or flu. But you go doctor. Until then, you're gonna get confused, or because you have to take a medicine, but you don't want to just take medicine for flu when you have just a cold, right? The vice versa too. Same thing, but when you know what's going on in you, you can be confident to take certain specific medicines for that, and you can believe that medicine can help your sickness, your flu or cold. When you know that you have a problem, but you don't know what it is, and that's gonna be very hard for you. You're gonna think if that is cancer or pneumonia or whatever. You just think this and that so many times until you see your doctor and your doctor say, "Oh, this is kidney cancer." Okay, that is crystal clear, so you can just get proper treatments and medicines from your doctor. Until then, you're gonna just think, what is going on? My blood is bad, or my urinary system is bad, or how come I'm so tired because I got too much stress? Am I getting coronavirus or whatever? But you have kidney cancer. That's why you have those symptoms. And it's gonna be clear to your worries and concerns, right? The families can suffer because the sufferers rituals. You don't know what's going on, but one of your families is doing something odd, which can cause distress and disruption to family members. That's right. Hard to leave those people, but they love each other, so they have to take care of each other. So they got too much stress. I think the causes of OCD are not fully understood. There are several theories about the causes of OCD, and compulsions are learned behaviors which become repetitive and habitual when they are associated with relief from anxiety, which we mentioned already. OCD is due to genetic and hereditary factors. You just learn something from your home and you just do it without knowing. That is odd. Chemical, structural, and functional anomalies in the brain are the cause. So brain problem. Distorted beliefs reinforce and maintain symptoms associated with OCD. Yeah. Then how to do those are causes of OCD and how to treat. What are the treatments for the OCD? The treatments for OCD can include physiological, psychological treatments such as cognitive behavior therapy. Behavioral therapy means it's kind of just taking care of the thoughts and actions. So by doing so, just change the logics, uh, and then behaviors. By changing the behaviors, they can feel something different. And anxiety management techniques, whenever they got anxieties, they can do something else rather than compulsive or obsessive behaviors. Or supporting groups like pulling ears or biting their fingernails, and they just stick the blood under the fingernails. It's kind of hard. They don't want to show their fingers, so they don't sit like this, but they just hide their fingers because they don't want to show that to others. Sports groups and education. Yeah, group therapies are working, and medications. We can use medicines anytime, right? Cognitive behavioral therapy. So what the cognitive behavioral therapy? That aims to change patterns of thinking. So once you got something, when you got triggered by something, your thinking process is always the same, but you want to just change the process. Okay, patterns. Beliefs and behaviors that may trigger anxiety and obsessive compulsive symptoms and reinforce those symptoms. So you change the pattern of your thinking and behavior. This therapy uses education to promote control over symptoms. The education includes, it takes time though, right? What if you spend lots of years for doing something, particular rituals and thinking pattern, then it takes time. Education includes the information that helps to expose myths about the cause of the OCD. Yeah? And part of the therapy involves gradually exposing the person to situations that trigger their obsessions, and at the same time helping them to reduce their compulsions and avoidance behaviors. This process is gradual and usually begins with less feared situations. The exposure tasks and prevention of compulsions are related daily and consistently until anxiety decreases. Over time, this allows the person to rebuild the trust in their capacity to manage and function even with anxiety, right? So they can be used to it, and this process is known as exposure and response prevention, ERP. Okay, right? Anxiety management techniques for sitting, and this, the second part of the treatment. Anxiety management techniques can help a person to manage their own symptoms, such as techniques can include relaxation training, slow breathing techniques, count to 1 to 10, right? But when you got really angry, you just count fast. 1, 2, 3, 4, 5, 6, 7, and 10, and you just do whatever you want. But you don't do it. 1, 2, 3. So you just learn how to slow down, right? And then breathing, deep breathing like yoga or whatever, and mindfulness, meditation, and or prayers. I think Christian prayers can help you when you to just coming to avoid too much anxiety, because you are just talking to somebody you can trust. That's your God. It can be your Buddha or whatever. And then these techniques require regular practice and are most effective if used together with a cognitive behavior therapy treatment program. And OCD supports group and education that works for OCD, and support groups allow people with OCD and their families to meet in comfort and safety and even receive support. And you are sitting with other people you can trust, and you can share what you feel and what you experience, and then other people can share theirs, and you can understand, oh, others can feel those things too, and others have problems too, and you can share, how to manage your obsessions and compulsions, and how to avoid the anxiety. You have your own solutions, your routines, and you can learn from others too, and you can adapt to those things to you, and then you can have some benefits from that. The groups also provide the opportunity to learn more about the disorder and to develop social networks. Okay. And medication for OCD, there are some medications, especially antidepressants, that affect the serotonin system, have been found to reduce the symptoms of OCD, and it helps you calm down a little bit. And this medication can only be prescribed by a medical practitioner, sure. And side effects of antidepressants may include nausea, headaches, dry mouth, blurred vision, dizziness, and tiredness. So, because of my job, I visit the nursing home a lot. I couldn't do that for 2 years because of the coronavirus. So I don't want to kill them all by visiting them, because nobody knows whether you have coronavirus in you or not. So I don't want to just contaminate a whole building and kill like 200 seniors or something. So I couldn't done that for 2 months, I think. But when you go there are some healthy and very active seniors. They have good enough power and physical energies, but they have some mental problems. And then after a couple of months, you will see, and I used to see, those very active, healthy seniors are sitting on the chair and sleep a lot, talk less, move less. That's sad. That's sad. I think we have better solutions for those people. The nursing homes and senior, hotel or whatever, they have to start feeding those active seniors antidepressants too much. Unless it's going to be very hard for them to take care of them. I understand that, but we need something else. That's sad. These effects often decline after the first few weeks of treatment. Few side effects are severe or last for a long time. You should discuss with your doctor, and it usually takes several weeks for medication to deliver any effects. When reducing or stopping medication, the dose should be reduced slowly under medical supervision. Research has shown that children with rheumatic fever who developing synonyms Korea at higher risk of OCD, so early treatment with antibiotics may reduce the chances of future obsessive thinking. Hospitalization for OCD. Assessment and treatment in hospital can be helpful for some people, particularly when symptoms are severe, they need to get more attention, right? Staying in hospital may last from several days to a few weeks. And there are many ways that you can help yourself in addition to seeking therapy. Some suggestions are just to refocus your attention, like doing something, exercise or playing a computer game. And being able to delay the urge to perform a compulsive behavior is a positive step. And write down obsessive thoughts or worries. This can help identify how repetitive your obsessions are. So those are for OCD, and I think some of you just feeling that, oh, there was OCD I had or I'm having right now, and then but again, you want to just be careful when you diagnose this to yourselves and others, but you can just take your time to see what's really happening to you and others. So you want to just be careful for diagnosis, for avoiding misdiagnosis, and then you're gonna make some problems with that. But anyway, there are some effective treatments you can take for others and yourselves, and then just be wise to use those kind of treatments, and then it's gonna be helpful. And don't forget to add proper counselings and good enough, encouragement for treatments, and then that helps to those people, I think, and then it's gonna be make a good results, I believe. Well, that's it for OCD, and I'm going to see you next week.